Let's begin by addressing their use in cancer treatment. So tyrosine kinase inhibitors generally in the context of in oncology or in the context of cancer treatment, they induce specific mechanisms. They signal transduction mechanisms that broadly lead to two different, if you like, mechanisms or pathways. They either activate autophagic clearance of oncogenes, or they modulate the immune system. So if there is any immune, or there is always immune involvement in oncology, they actually modulate the immune system. Now, in the context of neurodegenerative diseases, it's actually two sides of the same coin. Okay, think about it. In cancer, you have an oncogene that you really have to suppress or get rid of or basically mitigate. In the context of neurodegenerative diseases, as far as we know, neurodegenerative diseases are caused by accumulation of unwanted proteins in the brain. They could be due to environmental factors. They could be due to gene mutations. They could be due to several things, toxins and so on. So what we have here is actually accumulation of species that we need to get rid of. Okay, and this is exactly where tyrosine kinase inhibitors have a big role. If you actually inhibit a tyrosine kinase, you induce autophagy. Autophagy leads to clearance of these unwanted proteins, if you like, misfolded proteins in the brain. And it is possible that either, degradation or clearance of these toxic insults, such as misfolded proteins, will lower inflammation, or these tyrosine kinase inhibitors directly act to basically lower the level of inflammation as it does in cancer. So here we have a mechanism in cancer that is of paramount importance to neurodegenerative diseases. It's actually the same thing at the end of the day. In cancer, you have to degrade an oncogene, modulate inflammation to limit tumor growth. And in neurodegenerative diseases, you have unwanted proteins that you have to clear. You have to mitigate their faulty actions, I would say. You have to lower inflammation and, in a sense, get the brain rid of all these toxins. So we can at least halt, hopefully, the progress of neurodegenerative diseases.